Another type of neurological condition is a seizure, and it's just a surge of electrical activity in the brain. We don't really know a lot about seizures. It's estimated that 2 to 3 million people in the United States have epilepsy, so you will definitely be called to people who have had a seizure in your career. There are different types of seizures. Don't worry so much about the names of the different types. I'm just going to talk about each of them because I want to make sure that you know the different symptoms you may see. So a generalized seizure is what you commonly think of as a seizure. The person goes unconscious. They usually fall to the floor. They're twitching all the muscles of their body. Most of them last 3 to 5 minutes. It can last longer. And after this, they go into what's called the postictal state, where they're basically recovering from the seizure. That's a generalized seizure. They fall to the floor, they're twitching. Tonic-clonic is pretty similar to a generalized seizure. They go unresponsive, but instead of twitching, they basically contract and then relax all their muscles. Contract and then relax. And with tonic-clonic seizures, it's really common for people to lose bowel or bladder control. An absent seizure is not at all what you think of as a seizure unless you've studied this stuff before or know somebody that has seizures. An absent seizure is where somebody just zones out into space for a couple seconds, just like I just demonstrated. They just briefly kind of leave consciousness. They just kind of stare, and then they return. They have no memory of the event. They don't know what happened, and it's just a couple seconds. That's an absent seizure. A partial seizure or a focal seizure is when they don't lose consciousness, but they might have these kind of numbness, weakness, dizziness, visual changes, unusual smells and tastes. See how that kind of sounds like a stroke? And they may have some twitching or brief paralysis. Again, it kind of looks like a stroke or a transient ischemic attack, a TIA, a mini stroke. A complex partial seizure involves more of the brain, so they kind of have altered mental status. They may be confused. They're having like repetitive motions like lip smacking, eye blinking, isolated jerking. They may have unpleasant smells, visual hallucinations. They may be scared, or those repetitive physical behaviors. An aura is something that patients might experience before they have a seizure. It's just they can feel that they're going to have a seizure. And when people have these, it's good because they can get in a safe place. They can, if they're driving, they can pull over. If they're, standing up on a hard floor, they can lay down on a soft bed, things like that. Status epilepticus is when somebody has a seizure every few minutes and they don't regain consciousness for 30 minutes. Or they may just have a seizure straight through for 30 minutes. Once they've reached that 30 minutes of seizing and or loss of consciousness, that's called status epilepticus, and it's really dangerous for the brain. So what causes seizures? Well, there can be congenital causes. We just call that epilepsy. That means the person has seizures. There's nothing that we really know of that causes it. They were just born with that thing. It may not start in childhood. They may be older, but they just suddenly start to have seizures. It can be structural, something wrong with the brain, a tumor, infection, scar tissue from a head injury, a stroke. It can be metabolic, low levels of oxygen, low or high levels of blood sugar, poisoning, a drug overdose, withdrawing from alcohol or medication. And then the one seizure that you do need to know the name of is called a febrile seizure. And these are caused by a sudden high fever. So make sure you know that febrile seizures are caused by a sudden high fever. And these are common in children. They have some sort of infection that spikes their fever, and they suddenly have a seizure. Some people who have epilepsy may be given medications to help control their seizures. They can also put in a vagus nerve stimulator to help with that. But the medications don't always correct it. It may help them have less seizures, but it usually doesn't. Just most of the time, it's not often that it completely corrects it. Okay, your job is to recognize when a seizure's happened and whether this seizure is different from what's happened before. People who have epilepsy, who have seizures all the time, it's going to be no big deal. They're going to have a seizure and they're going to go on about their day. So you want to look for any other, did they injure their head, neck, or back when they fell down from the seizure? Did they bite their tongue? You know, are they hypoxic, or do they have low blood sugar from the work they put in while they were having the seizure? So the postictal state you'll usually see, especially after those generalized seizures where the person's, you know, unconscious and twitching all over. Basically, the postictal state usually lasts about 30 minutes after a seizure, or can last up to 30 minutes after a seizure. And the person's basically recovering from that seizure. When you have a seizure, you're not breathing and your whole body's twitching. So imagine basically running as fast as you can, sprinting as fast as you can while you hold your breath for even 3 to 5 minutes. When that's over, the muscles have to relax. The breathing is going to be extremely labored. The person's going to be kind of confused. They might be lethargic. They may even be paralyzed on half of their body from that lack of oxygen getting to their brain. And if they don't start to get better and come around soon, you want to consider maybe something caused this seizure that's still causing a problem with the brain, like an infection. Maybe they have low blood sugar. Anytime you have somebody in the postictal state, you always want to definitely check their blood sugar and their oxygen saturation, because we can easily fix those things. Okay, syncope and seizures can sometimes get confused. Syncope, the person just faints and then wakes right back up. Seizures, they're going to faint, and then we're going to see some contracting and relaxing of muscles, or some twitching of muscles. And they'll have that postictal state. Whereas with syncope, it's just really quick. They kind of go out and they immediately wake right back up. How do you treat seizures? Basically, they need to go to the hospital to figure out what caused the seizure. A seizure itself is not a medical emergency necessarily, especially if somebody knows what caused it. They have epilepsy, or they're, you know, something like that. But if they don't know what caused it, we really need to get them to the hospital to figure out what caused the seizure and correct the problem so they don't have more seizures. It's kind of the brain telling the body, hey, there's a problem here. If you show up and a patient is still having a seizure, you won't see this super often because, again, most seizures are over within 3 to 5 minutes. But occasionally maybe you experience a outside of work, you see somebody have a seizure, or you have a patient that has a seizure because it was caused by infection or one of these other things you're treating. So if somebody has a seizure, the most important thing is just protect them from harm. If there's something that they're nearby that could fall over on them or that they could hit, move that out of the way. You know, move chairs and tables and stuff out of the way so they have plenty of room to have a seizure. Keep their airway clear. It may not be safe to suction while they're seizing, but as soon as they're finished seizing, suction their airway. Get oxygen on them. If it's safe, you can put the oxygen on while they're having the seizure. Even if they're not breathing, they'll passively get some of that oxygen into their lungs. If you think they have a head, neck, or back injury, once they've stopped seizing, provide spinal immobilization. Put a C-collar on, hold C-spine. But there's not a lot you can do for somebody having a seizure while it's happening. Never try to hold them down or anything. If you try to hold them down, you can dislocate their arm, you can dislocate hips, you can break bones, cause bruising, you can make it a lot worse. So just let them have the seizure, call for ALS if the seizure is going on for very long, and get oxygen on them if you think it's safe.